Okay, so our objectives of today are very simple. We want to look at definitions of public policy. We want to discuss the definition implications. We want to discuss the importance of public policy, describe the types of public policy. We'll look at the different levels of policy, and we'll be able to discuss the political and environmental considerations of policies, and then we'll differentiate between a policy and a program. So, what comes to mind when you think about public policy? We'll start with Karigi. What comes to mind when you think of the term public policy?
Yeah, when I think of public policy, I think of a plan of action that is usually formulated through a political process. And the aim of this is to respond to a particular problem that is identified by maybe stakeholders.
Thank you. So a particular plan for future, it is a action by some big people out there. Thank you. That's great. Let's hear from Kimanzi. What comes to mind when you think of public policy?
What comes to mind when I think of public policy is some form of a regulation that is laid down and that must be followed when someone or an individual within an organization or within government is expected to perform a certain task.
Thank you. So regulation, we think about government, we think about expectations. It's not just drawn, it's expected to be followed to the end. I believe so. Thank you. Let's see some of the examples we could think of. We talked about registration, we talked about written regulations. The guidelines we have in our clinical practice actually form part of public policy, or there's some of the things we could think about. We have actions aimed at certain goals. More often they are documented. That we often think of policy being the responsibility of parliamentarians, because more often than not, it is Parliament which actually approves those policies. So our focus for this lesson will be more on public policy in health. Let me start by asking, where do you think those parliamentarians get information from to draw the policies? Rachel?
The different stakeholders in the health sector, starting from the lowest level of health, from the health staff to up to the ministries, and when they get such information, they can be able to formulate the policies on health.
Thank you, Rachel. So you've told us something very important, cascading, that the information is generated from the lowest level to the highest level of organizations. I don't know whether it sounds more close to the current motto of your government, the bottom-up approach, but I hope information in policy formulation actually is a bottom-up approach, at least when it regards to generation of data and information. So let's take a moment and look at definitions of policy, so public policy. I will ask Karigi to read for us the first definition, and then I'll ask Kilonso to read for us the second definition.
Okay. Policy is a law, regulation, procedure, administrative action, incentive, or voluntary practice of governments and other institutions. And this definition is by CDC 2015.
Thank you. Second definition.
According to Jeff 2022, public health policy is a plan for future action adopted by a governmental entity formulated through a political process as a response to a public health concern perceived by multiple stakeholders.
Thank you. And I'll ask Mansi to read for us the third definition.
Public policy is a system of laws, regulatory measures, courses of action, and funding priorities concerning a given topic, promulgated by a governmental entity or its representatives.
Thank you. So given those three definitions, and remember we say there is no universal definition of public policy, we have different definitions, but we can be able to see some common themes from those definitions. What are some of the themes you can note? Rachel, from those three definitions, what are some of the themes you can note from the three?
A policy entails laws.
Thank you. Law.
Procedures.
You have procedures.
And regulatory bodies for it to be put into action.
Okay, so we have regulatory bodies which somehow control or ensure that actions are within boundaries. Thank you. Kairigi, anything you want to add?
Yeah, I'm seeing from the third definition that policies need funding, and funding is a priority, I think, from this definition for the implementation of the policy.
Thank you. So we are looking at allocation of resources. Thank you. I think all of us are in the right order or in the right thinking. Let's see some of the implications we could mention. There are many, but these are just a few. One, those definitions often imply that public policy covers clusters of entangled issues, and that public policy, as the name suggests, is a public process, and it's definitely a collection of laws, regulations, guidelines, and all those congregate to make policy. The actions chosen and adopted by government or its agents or agencies become part of the definitions. And as we were told by Karigi, policies actually reflect resource allocation priorities. If you want to know where the government priority is, look at where most of their resources are allocated. And policies focus into the future. The other thing we mentioned is that policies are a guide. They guide our actions. They can also be seen as the accountability link between the citizens and the government, and just ensuring that the government actually provides or does what they committed to do. Policies are also a means through which government maintains order. Remember, we said we are trying to put regulations which control what different agencies do. If we left those agencies to do whatever they wanted to do, you can imagine what chaotic environment would create. But most important is that policies are developed for the best interest of citizens of any country. So they should be implemented, or they should be developed to solve specific social problems. So more often than not, we call them issues rather than problems. It's not always that they're solving problems. At times it could just be addressing issues. And government activities which are pursued by government or its appointed agencies are called policies. I want to emphasize on agents, because whether you're in public or you're in private sector, whatever you implement, especially in public health, is dictated by the government. Thank you. So you're going to take a moment and then you tell us, why do you feel policies are important, and especially in public health? And we could also focus it more on health systems, our course for today. Let me start with Kimanse this time. You are the last. Tell us, why do you think policies are important?
I think they are important to bring some form of order or sanity, or to ensure that things are done procedurally. We do just wake up and people do whatever they want to do. It serves more of a guidelines to ensure that we follow a certain standard, to set standards of doing things.
Thank you. So we have order.
Yes.
And we have procedures. Thank you. Kilonzo?
I think a very important function for policy is that it is generally aimed at protecting the citizens of that country. And thinking about when it comes to health, there are policies that guide how healthcare professions or professionals are trained and licensed. So these are the people who end up giving health services to the patient and the general public. So with that way, the government is able to protect the citizens from, for example, quacks, by having policies that dictate the education and licensing of healthcare workers.
Well done. Thank you. So we think from the source of the health care providers, starting from training. Thank you. Then we'll have Rachel.
Policies play a bigger part when it comes to putting into programs, which is actually what public or actually the government works through. Like we can see that major policies come up with major programs like the immunization programs, the UHC programs, and such. So policies help the government to aid in function of major programs.
Thank you. So they actually guide programs. That's what you're telling us. Thank you. And Karigi?
I can link it from a different perspective and say,
Please go on.
they may act as linkages between the government and its citizen. Because now, when we look at the identifying problem, when it is solved, the citizens are able to well identify with its government, because there are issues, there are problems, and anything concerning them is being taken care of. So there's that good linkage between the government and its citizen.
Thank you, Karigi. So we have accountability and linkage. We still want to ensure that the citizens feel like there's a government in place which is taking care of them. Thank you. We've got to take one moment and look at the types of policies. I think we've talked about all these roles of policies and definitions, but we'll take a moment and ask ourselves, what are some of the types of policies which cover or which meet these needs of the citizens? We're still going to have a participative approach, and so we will ask the first person, we'll ask Rachel to read for us the first type of policy. Tell us what they take from it. Rachel? Rachel, you there? Okay. As we wait for Rachel, you read for us the second one. As we wait for you to set up your mic, we'll have Kilonzo read for us the first type of policy.
We have the distributive policies, which give resources away to the target groups. So they give subsidies for example, giving subsidies to the farmers.
Thank you. Can you think of one distributive policy in health? I know we have the current one of subsidizing to farmers, but what specific policy do you feel is distributive in health?
I'm thinking about NHIF because the government has tried to really subsidize health by providing a national health insurance scheme that is affordable with different rates and according to the ability for the citizens or the general population to pay for these services, which goes to as low as 500 shillings a month to cover for health services in different public and private hospitals.
Thank you. So we are getting from the richer and giving to the less fortunate or less resourceful. So we have households which pay 500 bob per month, and we have other households which pay as much as 4,000. Especially both of you are employed by the government. Thank you. Okay, so we're going to have Rachel, you read for us the second type of policy.
Yeah, we have the redistributive policies. These are policies which take away resources from one group to give to another, such as progressive tax policy or pay-as-you-earn policies. Yeah.
Give us an example and how you feel, one you feel is in health policy. A redistributive policy.
I can relate to the NHIF, whereby civil servants contribute a higher amount, lesser than the others that are self-employed, and with this, it comes to a pool of money that can be used to get health services to the people.
Thank you. So we have both NHIF following along distributive policies as well as redistributive policies. Okay. I'll ask Kimanzi to read for us the type 3.
Type 3 policies are self-regulated policies, and these are policies which delegate authority and responsibility to a group for self-administration. An example in health, I think, is the professional medical bodies, regulatory bodies like the Nursing Council of Kenya or the KMPDC to regulate either practice or to regulate drugs or to regulate training and practice.
Beautiful, thank you. I think that's well, you've explained it very well. And we know the role of state corporations and the local councils. Then we will ask Karigi to read for us number 4, type number 4. Type number 4.
Regulative policies. These are policies that restrict available alternatives, such as specific acreage allotment of plots to farmers.
Can we think of an example in health?
Yeah, like I'm thinking of this policy. I think it is given by the body for doctors that allows healthcare professionals to practice that formally stated that a nurse cannot enter into private practice unless you've served the government for 10 years.
Thank you. That's one example. Another? And you can think of NHIF in this regard, and this is open to any one of us can answer that.
I'm thinking about policies that govern tenders in our country. We have, so maybe if it is a tender that is serving any aspect of healthcare, we have a policy that mainly says that a certain percentage should be left for women, youth, and people with disabilities, or some specific tenders are given to that particular group of people.
Great. That is a perfect example of a regulatory policy in our country. Okay, number 5, segmental policies. We'll ask for Clonzi, back to you.
Sorry, before we go to segmental policies, I'm thinking of in healthcare where NHF says that you cannot spend above this amount in a certain investigation like MRI. Is that a regulative policy?
Thank you. That is a good question, and that's a regulatory policy. And in fact, it's not just you cannot spend a certain amount of money on specific investigations. It's because there are specific hospitals designated for those investigations. So you have to go to a public facility, and if you choose to go to a private facility, then you have to pay any top up from your own pocket. That's a good example of that. Thank you. Okay, so segmental policies. Now that we are at it, Karigi, please read for us. You're reading for us what segmental policies are all about.
Okay, segmental policies. These are those policies which affect different groups or specific areas less than the total population of different times. Well, famine relief in particular geographical area is an example.
Thank you, Karik. You can tell us what is happening, especially currently, with the famine which is in the country. Have you seen the government directives on who should be given famine relief, who should not be given? Tell us about it.
Yeah, we've seen it in the media.
Which counties are we focusing on? What is the criteria of a county qualifying to get relief food?
I know Turkana, they are getting, Baringo, they are getting, Kajiado, the other day, the wife of the deputy president was there, launching, giving of relief foods. Yeah.
Okay, have you seen a map which has of Kenya displayed during news, which shows some areas are red, some are yellow? Does it have a meaning?
Yes.
It's a meaning in those color codes.
The red ones are those the mostly affected, actually those which needs to receive the relief food.
So we have coding and we have levels of severity. The most severely affected, some moderately, some mildly. But even in those areas where we have mild effect of the famine, we also have kind of segmental policies. School feeding programs, do you feel they are segmental policies? What about?
Yes.
Thank you. What about HIV care? Is there any segmentation we've done when it comes to HIV care?
HIV, I think that's okay. I'm not sure, but I thought it's universal. In all the CCCs, I'm not sure of the segmentation as far as HIV care is concerned. That one I'm not sure.
Is there a time when you would have medication preserved or set aside specifically for HIV clinics? And yes, they are in the pharmacy, but they are designated for this group of people.
Yeah, that one is actually there.
Thank you. And remember, we said policies range from the lowest to the highest. They start from program level to the national level. So when you think about policies, you also think about the government. You also need to think about our operational level policies. Okay, who's gonna be the last person standing and read for us the last type of policy? A volunteer.
Area policies are policies which affect the whole community or a whole district, province, state, or for example, national elections. What I would think to be area elections is area policies. Policies like you should not practice without practice license. Yes.
Good. Have you seen people who've come from Middle East or they've been trained out of the country and they want to come and practice as nurses in Kenya? What happens?
They are put on mandatory training or licensure examination. They're observed for a few months before they are given license.
Good. So we may have some which operate as regions, others which operate just as countries, but there are those regulations. And talking of elections, there are countries where if you do not take part in elections, you pay a fine, and a hefty fine. An example is Australia. Let me ask, how many of us voted in the last election?
I did.
You did. The others did not vote.
I did.
Maybe
voted.
Oh, good. Then you're good citizens. It's because maybe the next time we need to introduce a law in Kenya where if you don't vote, then you should pay a fine. Because more often than not, we don't vote and then we start screaming when things do not go right. Okay, so those are types of the public policies. We just take a moment and look at levels of public policy. This is probably self-explanatory. We have mega or master policies, and these are usually policies which provide overall guideline for a set of discrete policies. For example, Sessional Paper number 10 of 1965 in Kenya, the National Constitution of Kenya, the strategic plans, which are usually drawn either for 5, 10, 15, or 20 years, and we have the National Development Agenda, usually done for around 7 years. The content of these mega policies usually look at ultimate end. We have the end in mind. We focus on national goals. We have philosophical ideas. And more often than not, they involve the organization, vision, and mission. Closely related to this mega policy are strategic statements which are aimed at moving today's national posture to a desired future position. When you look at them critically, especially in our current government or the government is always in place. What do you feel are some of the mega policies we have in place in Kenya today? And they could be related to health or they could be related to something else.
Vision 2030.
Sorry?
Vision 2030.
Vision 2030. Thank you. What are some of the health aspects of Vision 2030?
affordable healthcare to all.
Beautiful. Affordable healthcare to all. What else? You remember Jubilee government had some key agenda. That could be a link, or that could be a clue. We had affordable healthcare.
Yes, yeah. Universal health coverage.
Universal health coverage. What else?
Maternal.
The Big Four.
The Big Four.
agenda.
Yes. We had healthcare.
World-class infrastructure, facilities and services.
Facility and services. Okay. Good try.
Beyond Zero campaign.
Beyond Zero was not a part of the four. It was under healthcare, universal health coverage. Do you remember manufacturing?
Yes.
Do you remember housing? What was the fourth one? I'll give you a clue. Industrialization.
Yeah, industrialization.
Hapana, hatukuita industrialization. There's a name we called it.
Economic pillar.
No. Hey, you guys are not economics or you're not politicians. Please go back and hold the Jubilee government accountable. Remember, policies about accountability. And we can ask them, did you actually meet the four big agenda? All right, let's try and look at the second level. And I will ask Rachel to read for us.
Okay, the second level, we have the functional policy, or what we call the operational policy or administrative policy. These include organizational policies, departmental policies, ministerial policies, administrative plans, and operational plans.
Thank you. You can give us a number of examples, especially from our working stations, our work environment in health.
From a work environment, like I work in an hospital setup, there are various policies on how to handle patients and contact yourself at your place of work and such.
Thank you. Any other?
In the hospital setup, we can talk about operational plans or policies, whereby, for example, every patient is required to have a file, and also possibly on admission, they should have baseline investigations.
Thank you. Well done. So we have many. We have the simple policies like infection control policy. That one is everywhere, isn't it? OSHA. What was OSHA about? Occupational safety and
Health, environment.
good. We have policies regarding
Gemba.
Sorry?
Gemba Kaizen.
Good. Those are some of the policies we have in our functional level policies, and we can think of many. Now, the people who love big things, Karigi, read for us meta policy.
Okay, meta policy, that is beyond policy. This is a policy dealing with the characteristics of the policy making system. For example, cabinet policy, analysis units, policy analysis and research institution known as think tanks by KIPRA and IPAR.
Those are examples. That's an example of think tank. You've heard of KIPRA? Have you heard of Kipra?
Sorry?
Kipra.
I've not heard of it. That is why I'm saying by Kipra and Kipra.
So as we proceed, I'll leave it at that point, and before we finish the next 3 slides, I want you to tell us what Kipra is and what they do in Kenya, okay?
Okay.
Just have that after the second slide, or after we've discussed a few things, then
Kipra.
you tell us what Kipra is all about. Those are some of the agencies we should be looking forward to working with. And if you're not going to be a member of cabinet, then let's try and go influence policy at Kipra and IPAR, right? Thank you. So as Karigi looks for that, let's look at some of the issues we consider when looking at policy or analyzing policy. Now, whether we are looking at mega or operational level, or whether we are looking at distributive or redistributive policies, we need to appreciate that policies occur in a political environment. And that political environment influences how policies work. One, policies are political process. It's all about government and the politicians of the day. And policies occur in a very dynamic environment. Somebody called Easton, David Easton, looked at policies as a political system. And what we have on that slide, that shows that political systems exist in an environment. That environment has inputs, and those inputs are what constitute demands and support which is given to the political system. The political systems processes or formulates policies, and they communicate the decisions and actions, and then those decisions and actions are implemented, and they give us certain outputs or outcomes, and those outcomes then dictate what inputs are all about. If you look at it keenly, it is actually a reflection of systems thinking. And as it's the trend or the characteristics of systems thinking, we are basically saying that that political system is made up of small components. But let's take a moment and mention something small about the environment and about the political system. So a public policy process can be divided into several parts according to David Easton's model. The environment, basically meaning the setting of the policy. We need to appreciate that there is variation in context. The policy which is developed by the national government may not be implemented identically in different counties, because we know different counties have different variations in context. And so if you're going to implement policies, then, or we're going to develop policies, then we need to do situational analysis. Let me give you an example. Now we are giving food relief. We are trying to deal with malnutrition. So if you give food like maize and beans to the people living in North and Eastern, do they have water to cook that food? Or would you rather give water first before you even give the supplies of cereals? Then you go to places like Kajiado. It may not be so dry, but there are sections which are seriously dry, but availability of water in Kajiado is different from northeastern Kenya. And so you analyze and you see, where should I take what supplies? What should be my first priority? Yes, the government is giving food supply cereals, but probably in northeastern we need to think about water, supplying them with water before we can even think of cereals. So basically, one implementation plan does not fit all. And we need to look at environment in all aspects. One of the ways of analyzing that environment is basically looking at situational analysis. And one approach we use is PESTEL approach. You can guess what PESTEL stands for? Let me start with Kari. Can you guess what PESTEL stands for? P.
Pastel.
Sorry?
Pastel. Political.
Yes, the first term is political. The second? And anyone else can guess. It's an acronym for something. E.
Economic.
Thank you. Economic. S.
Social.
Social.
Technological.
Beautiful.
Legal and environment.
Beautiful.
Factors.
Legal and environment. That is PESTEL approach. So we consider all those factors just as a framework to ensure that we don't forget some of the aspects we need to consider. Now, the environment also involves government structures. Right now we have county governments, and we have given leeway and a lot of control to county governments. Then we have programmatic considerations, what programs are going on in place, and then cascading of implementation. Of course, every level will implement the policy situationally. Okay, then we have inputs. And inputs in Easton's model look at the public demand and resources. If anything, if nothing or no other input you need to remember the role of government in public policy. One, they're the main healthcare service providers. They regulate the private entities. They are the taxing authority. They are the highest healthcare purchasers and payers. They are adjudicators in disputes, and they enforce the law. All those factors will influence how policies are formulated, how they are implemented, how they are evaluated. As with any systems, remember we have a throughput. That means all that information has to be taken through adaptation. It has to be taken through active processing to make information which can guide us in decision making. And remember, we have policy outputs, and just like any systems approach, we have short-term outputs, we have medium outputs, and we have long-term outputs. And remember, system thinking, there is always feedback mechanism. Whatever output we have is actually what feeds into the environment and provides the input. That means we have self-regulating mechanism. The obvious view of that Easton's model is basically to say that politics plays a big role in policy formulation, and whatever policies we form or we develop act or play out in a very dynamic environment, and that environment gives feedback because we have both intended and unintended consequences. Okay, before we proceed, we want to ask Karigi to tell us what she found out about Kipra. What did you find out?
I found that Kipra stands for Kenya Institute for Public Policy Research and Analysis, and it is an autonomous public institute that was established in 1997 through a legal notice and commenced operations in June 1999.
Wow.
So its activities conducts objective research and analysis on public policy issues with the goal of providing advice to policymakers. 2, on public policy issues to the government, government agencies, and other stakeholders. 3, they disseminates are the same. Its research finding to a wide range of stakeholders through workshops, conferences, internal seminars, research papers, policy briefs, and newsletters. 4, they develops and maintains research resources and databases on public policy and written issues, and avails this to the government, the private sector, and academic institutions. And they also undertake capacity building activities for government and private sector. And they serve as a point of contact and encourages exchanges of views between government, private sector, and other civil society.
Thank you. I'm sure we've all learned something. And now we know why they are called the think tank of the government when it comes to policies. As we close, let me ask us to look at something very small, the difference between policy and program. We tell you today, we want you to develop a program, and we tell you to develop a policy. What will be the difference? I will ask Rachel. You can read for us that slide and tell us what your take is from it.
Yeah, the differences between a policy and a program. A program is embodiment or implementation of a government policy. Scale of a scale program versus a policy. And a policy can allow for adaptation at the program implementation level. So I would think that policy is what constitutes what makes up a program. We start with a policy, then we go to a program. Then one thing about a policy, you can do adaptations to it even when you are implementing, unlike a program.
Thank you. So we have different implementation levels. We have policies being higher, programs being smaller subsections of the policy. And programs allow implementation, adaptation of policies. Let's try and see whether that photo or that slide makes it more clear. So we can see the differences between the two. So we have constitution, and we have legislative statutes, we have policies of the ministry, strategies, guidelines, SOPs, and then we have resource implementers. So when you look at the left side, then we'll be looking at components of a policy. When you look at the right side, we'll be looking more of a program where we have National Department of Health, and we have Provincial Department of Health, then we have county governments, and we have public health facilities, and we have patients. So the biggest difference between a program and policy, one is the scale, and two is the operationalization of implementation. So public policy can be analyzed in 3 levels. 1, policy making, policy implementation, and policy evaluation. At each of those levels, there are a number of considerations, but we will look at each of those levels in the next lecture in details and see what they are all about. Okay? Thank you. Unless there are any questions, we can call it a day. I'll take any questions now. Any questions? Any takeout?
Yes, from the video that we watched, I would love to kindly ask you a question.
Yes, do.
As the video was concluding, it was stated that policy decides which public health ideas, good or bad, are brought to scale. So, and in my thinking, I thought policies are usually for good issues. You know, they are usually for the good. They don't have an intention of
That's true.
presenting.
Thank you. Policies are meant to solve issues. They're supposed to be good things, not negative things. But there are policies which may have negative connotations or negative effect to some sections of population. Let me give you an example. Redistributive policy. If today you're told you need to give up your clinical allowance, your risk allowance for the next 6 months so that we can feed the starving counties. As a policy, is it good or bad to you?
Very bad.
There we are. So you've given us your answer that it could actually be good or negative. It's negative to you, but to the guys who are starving, it is very positive.
Good.
Yes.
Yeah.
Okay. Any other question? Okay, I'll give you the reference materials and we will meet next time and look at policy making process. Please have some time and read ahead, then we'll have some more to discuss. Till then, have a good afternoon.